Everybody needs a different tool. When a weight loss surgeon tells you that you need you only need a gastric sleeve, be careful because there are several options and everybody's different. We have laparoscopic techniques and endoscopic techniques, and to see what is the best option for you, we need to know your health history. We need to understand what is going on. So that is the only way we can give you the best tool for you. We can do laparoscopic, endoscopic, and we can do all the weight loss procedures because we understand that every patient is a unique patient, and we need to do what he deserves and also what he needs. Also, we have a lot of experience in revisional surgery. The revisional surgery is not for all the surgeons. You have to be really, really, you need to have a lot of experience to be able to perform safety revisional surgery. We can convert from gastric sleeve to Aaron-White gastric bypass. We can go to gastric sleeve to duodenal switch. We can go to lat band to sleeve to Aaron-White to duodenal switch. We can do reversal, and also we can do Aaron-White to duodenal switch. We do all the revisional procedures. We have the best expertise here in probably in all Latin America. We are number one in revisional surgery. We can mix laparoscopic with endoscopic. We can do both procedure in the same patient. So revisional procedures, you must be really careful to choose your surgeon. It has to be high level expertise. And here in Mexico Bariatric Center, you will find all the expertise that you deserve. Now with our new hospital, with a lot of that we have, so I believe this is something really important for our company or for the patients because when we do the things right, we're gonna have good results, and that's something really important. I need to tell you that in Mexico, here in Tijuana, it is a mix of a United States company with a lot of experience, nurses, surgeons. So you need to check. You need to see our hospital, right, Ron? And you will see the top level that we have. The
Yes.
last week, we have visitors from United States, and they say that our hospital is. You need to see. You need to see the hospital is. It's beautiful. We have all the technology, everything that our patients needs is gonna be there, and also the expertise of the of nurses, surgeons, everybody, our expertise doing this. So one of the gastric band. The gastric band was really popular in 2000s, probably from 2000s to 2010. There are a lot of patients with lat band. The lat band is a foreign body. It is a plastic ring that is in your stomach, from the outside of your stomach. And a lot of patients are having a lot of issues with lat band and also with regain. They can have acid reflux. They have regain of weight. So we can remove the lat band and make a conversion to gastric sleeve, Aaron-White, or duodenal switch. The most important part in after lat band is acid reflux. If you have acid reflux, the best option is going to be the Aaron-White gastric bypass because the Aaron-White improves acid reflux. This not happens with the gastric sleeve or duodenal switch, but if you don't have acid reflux, and if you have a really smooth conversion of the gastric band, we can do a sleeve or duodenal switch. But the lat band is it was a procedure that nobody. There's some surgeons doing lat band, but it's gonna be lat band is gonna be part of the history. Nobody's doing lat band anymore, and we are removing a lot of bands, and we have a lot of experience also removing bands. Probably we remove 2 lat bands per week. So yes, we have a lot of experience. The sleeve gastrectomy, the gastric sleeve, is the most popular weight loss surgery at this moment. It represents the 70% of the surgeries of the surgeries, weight loss surgeries in the world. So we have a lot of gastric sleeve patients. You need to you have to do a really good gastric sleeve technique. You must have a really gastric sleeve technique as a surgeon to don't have complications. Also, patients can have weight regain, and we need to do a re-sleeve. When the sleeve gets stretched or if the sleeve doesn't have a good technique, anatomic technique, we can re-sleeve the previous surgery. The success rate is not too high. Sometimes it's better to convert a sleeve to another procedure, like an air wide gastric bypass or duodenal switch. But sometimes it could be an option when anatomy is not okay from the previous surgery. So it's going to be a finding. But yes, we can do the sleeve. We can do it with endoscopy, or we can do it with laparoscopy. Endoscopy, I like it because there's no incisions. It's only a 30, 40 minutes procedure time. Um, we can shrink the sleeve from the inside with not absorbable suture. But if you need to lose a lot of weight, probably the best option is going to be a conversion from sleeve to MRY or duodenal switch. And this is the gastric sleeve to MRY gastric bypass. When 15 or 20% of patients with gastric sleeve can have acid reflux, GERD symptoms. The best option is to do a conversion to MRY gastric bypass because the reconnection of the small bowel in the stomach is gonna help you with the pressure of the intragastric pressures, and it's gonna relieve the acid reflux symptoms. And also, we're gonna lose more weight. So, a previous patient with acid reflux and weight regain, the best option is gonna be the gastric bypass. Successful results is gonna be around 40%, and also it's going to improve the acid reflux symptoms. So right now, the MRY gastric bypass is the gold standard in weight loss surgery, and is going to be a good option in revisional. The best option when you have a lot of regain or you need to lose a lot of weight after gastric sleeve is going to be the duodenal switch. The duodenal switch is number one in weight loss, is number one in control of diabetes, high blood pressures, sleep apnea, is the number one. This is the best weight loss surgery that we have. And I need to tell you that we are number one in the world in duodenal switch. So duodenal switch is not for everyone. It's only for patients that need a bigger tool. In duodenal switch, you need to take supplementation for life because the duodenal switch is the most aggressive surgery in weight loss surgery. And if you do your supplementation, you will not have no problem. But if you don't take supplementation, you can have malnutrition. Okay. So what we do in a revisional surgery after a gastric sleeve, we need to redo the gastric sleeve, remove the stretches areas, do a re-sleeve, and then reconnect the duodenum to the ileum. And that is the most powerful tool in weight loss surgery. So if you have a previous gastric sleeve and you need to lose a lot of weight and you don't have acid reflux, this is going to be the best option. The endoscopic sleeve. This is something that we do with high-level technology. To be able to do suture with an endoscope needs a lot of technology, and we have it here in Mexico Bariatric Center. Probably here in Tijuana, we are the group with more expertise in ESG. We have almost 4 years doing ESG. And what we do is to shrink the stomach from the inside. We don't do incisions in the skin. It is a kind of surgery because we need to do sutures, but we don't cut anything. We introduce an endoscope through your mouth. We get inside of the stomach, and we start suturing from the inside with non-absorbable suture. The success rate is going to be around 20%. If your BMI is around 27 to 32, this could be a good option. This is designed for patients that they don't have a lot of obesity and they only need to do a few pounds. This could be a good option because recovery is only 2 days. This because we don't do incisions, we don't cut anything, we don't cut skin or muscle, so you only need a few days to recover. You're gonna be able to do exercise, to go back to work, and it's gonna be really easy for recovery in endoscopic sleeve. But success rate is around 20%, and it's not for everyone. Okay. The gastric bypass to gastric bypass. Gastric bypass has around 70 years in weight loss surgery field. At the beginning of the gastric bypass, I don't know, probably it's 50 years ago or 30 years ago, the bypass, it was a little bit different. Right now, the gastric bypass is not the same as the beginning. It has an evolution. We understand better the weight loss surgery. We have more information. And this right now we are doing the current gastric bypass is a different technique. So sometimes we need to redo a gastric bypass to convert an old gastric bypass to a current gastric bypass. So we need to do a tune-up of everything. We need to go to the gastric pouch, to the anastomosis, and also to the reconnection of the small bowel. So success rate is around 50%. This is a big surgery because we need to understand previous anatomy and redo all the parts of the gastric bypass. And also, we have a lot of experience doing this procedure. Well, another option in after a Aaron-White gastric bypass is to do it endoscopically. We can resize the small, the gastric pouch and the anastomosis, the stoma, that is the connection between the gastric pouch and the small bowel. Normally has to be around 1.5 centimeters, but with the time it can get stretched. For example, if you have a gastric bypass 10 years ago, probably your stomach is going to be around 6 centimeters and you cannot feel restriction anymore. We can do a revision with no incisions. That is a endoscopic technique. As the same as the ESG, the endoscopic sleeve, we can do suture and we can shrink the stomach, the connection, and make it back again as the beginning. So it's really, recovery is really fast. We can only get inside of the stomach and the gastric pouch. We cannot go farther. So the revisional with endoscopic only give us 30% of success of weight loss. And this is because there are some parts of the gastric bypass that we cannot get access with endoscopy. We can only work in one part of the gastric bypass, that is the gastric pouch. But with this, we can have, we can do, we can go back to the track in the weight loss with this procedure. And this is one of the procedures that I like it more because we're having good results. And it's only 20 minutes procedure with a novel technique that is endoscopic suture. The gastric bypass to duodenal switch. This is the most difficult surgery in weight loss surgery. When I go to the bariatric meetings, probably there are only 3 surgeons in the world that are able to make this possible. You have one in Mexico Bariatric Center, and probably we are the team with more expertise. This is the technique that I'm going to share in the next book around the world. The conversion of gastric bypass to duodenal switch is a really hard surgery, but sometimes when patient has an old gastric bypass and they need to lose a lot of weight, this is going to be the only option. Success rate is around 65%. This is the most powerful surgery in weight loss surgery. This is a big surgery. Recovery is going to be same as all laparoscopic techniques. Yes, this is one of the most difficult procedures, and we are able to do it here in Mexico Bariatric Center. Mini gastric bypass to Aaron-White gastric bypass. Mini gastric bypass is a one anastomosis. They only have one connection in the with the stomach with the small bowel, and sometimes patient can have acid reflux. This is a good technique for weight loss, but sometimes mini bypass can give you acid reflux symptoms, and we need to convert to traditional gastric bypass to improve acid reflux. So yes, this is an option that we can do. This is something that probably we have 3 patients per week. It's going to improve the acid reflux, and also we can do a reconnection to lose more weight. Okay, so if you have a mini gastric bypass and you have acid reflux, bile reflux, that is a little bit different. Bile reflux is harder than only acid reflux. So the Aaron-White gastric bypass is the only option that you have, and we can do it for sure. As I'll tell you, duodenal switch revision, sometimes in the time of history, in the history of weight loss surgery, all the technique has changed, and we can redo all the old techniques to a curing technique. Patients with previous 30 years ago surgeries, that is not the curing technique. We have to do a different technique. We can do it, and also we can do a revision of the duodenal switch and make it as a novel technique with a novel technique that is the CDS. And we're having really good results because this is the most powerful surgery. The gastric balloon. Another option that we have is the gastric balloon placement. The gastric balloon is not for everyone. It's only for patients that is less invasive technique or procedure that we have. So the success of weight loss is not too high. And sometimes we need to remove the balloon and do a revisional and do a surgery. And we can do it. We have to do endoscopy first and then convert to a laparoscopic technique. We place balloons, we remove balloons, and also we can do all the procedures that of the gastric sleeve, every white gastric bypass, or do the on switch. So it will depend on the needs of the patients, but yes, we can do it.